For our next keynote, I'd like to introduce Janet Dillione. She's Executive Vice President and General Manager for Healthcare for Nuance Communications, and she's going to speak on the next generation of clinical technologies, the voice of healthcare, the value of understanding. Please welcome Janet.
Thank you.
Thank you so much.
Thanks. Okay, great. Thank you. Thank you. Good morning, everyone. Thank you. This is the first time I have followed a prince, although I do have two daughters who are princesses. And I think I'm the last thing between you and lunch. So hopefully in the next few minutes, I'm going to use my voice to give a perspective on the voice of healthcare and what we at Nuance are trying to do to help add to that voice of healthcare and tell the patient's story. We tell it about 20 minutes away in Burlington, Massachusetts, with a dominant force of our R&D, but we also tell it globally with offices in North America, as well as EMEA and in Asia. So what I would like to do, again, is talk about the voice of healthcare and communicating the patient's story. At the core of healthcare is clinical data. And what we are struggling with and have been struggling with is getting that clinical data to be understood and part of the patient record. Arguably, clinical data is the most important part of that patient record. And again, I joined Nuance 18 months ago after having spent longer than I'd like to say, but over 2 decades in healthcare IT, trying to solve the issues of clinical documentation and trying to find a way that we could capture data and make it important and useful for clinicians while not encumbering them with a process that was impossible for them to use. So again, what we want to do is tell the healthcare story, the story of the patient and the story of the clinician, to allow them to capture it anywhere, to understand that story, and to, most importantly, to use that story for good. As we know, clinical documentation is extremely important, high-quality clinical documentation. Clinical documentation provides a framework for healthcare. I don't know that if you're outside of healthcare, as I always tell people, I don't think a patient would understand what actually happens to communicate clinically to the other sides of healthcare to enable the processes that actually drive healthcare. It is important, and yet it is ridiculously complex today, and we've been unable to solve it. And that's what we are going to try to do. It's not only difficult today, it's actually getting more difficult because we have things like accountable healthcare organizations coming online, each and every one of you trying to implement an EHR, each and every one of you, I suspect, also having initiated a process called Implement ICD-10. A system that will take, I was at AHEMA last week, and there's absolutely, I'm playing with it a little bit up here trying to find some space, but at AHEMA last week, you saw fear in the eyes of professionals. A system going from 55,000 codes to 155,000 codes. And I'll share a little bit more of that as we go on. But the theme, again, is to make things easier, to move things along, to bring some sanity into the clinical documentation process, to tell the story of whether it be a heart transplant or a sprained ankle, and to make it more simple. The challenge of the IT system, again, is to fit within a clinical workflow, and I'm truly saying clinical workflow. Right now, we dominantly talk about a physician workflow, a physician dictation. It could as easily be applied to clinicians, including nursing and other extended care coordinators. And today, one of the issues we have is there's multiple preferences and ways physicians like to get documentation in. There are those that can type 100 words a minute and love being at a desktop and are very comfortable. There are those that strongly prefer a dictation workflow. There are those that strongly prefer speech recognition. The secret here, the secret sauce, if you will, is to get a technology that can sit behind all of those clinician and physician preferences and get the documentation workflow process